Currently it's 5-1, enough to get out. We're going to place that bill on call. I see Senator Leno. We're going to move to item number 13, SB 1404, Victims of Violent Crimes Trauma Recovery Centers.
Good afternoon, Mr. Chair, committee members. This bill does deal with how we get the very best outcomes at the lowest cost for victims of violent and traumatic crime. We traditionally use a fee-for-service model, and I'll just give you a brief example of how that works. Imagine a young mother standing in front of her house, cradling her infant in her arms, toddler playing at her feet, husband working on the car in the driveway, drive-by shooting, he's dead, maybe she's hurt, maybe one of the children is as well. And in her traumatic state, we, the state, expect her through this fee-for-service model to be able to assess the medical needs, both mental and physical, of her child, her children, and herself, deal with the husband's demise, funeral arrangements and all, be able then to identify where the services that she and her family need are to be had, to make appointments, to get the services, have the money in her pocket to pay for it, collect her receipts, and apply to the state to get reimbursed. Unfortunately, not surprisingly, it doesn't work all that well. In fact, we did an audit of the program not too long ago, and over recent years, though I think things have gotten a little better recently, we saw the costs continue to increase and funds getting to the victims of traumatic and violent crime going down. The good news is the legislature, through the leadership of Senator John Burton about 15, 16 years ago, invested a few $1 million to try out a new way of doing it, a holistic approach where all of the victims' needs could be attended to under one roof, the mental health services, the physical health services, the coordination of services with law enforcement, other social service agencies, again, all housed under one roof. Within a couple of years, it was recognized nationally as the most successful program of its kind. It got people victimized by crime back to work faster than traditionally, kept them off drugs and alcohol through their recovery from the trauma, kept families intact, even assisted the victims so well that they would work agreeably with law enforcement to be able to track down the perpetrator of the crime. So this is now known as the Trauma Recovery Program. The model program happened to be in San Francisco, collaboration between the University of San Francisco Medical School and San Francisco General Hospital. And if that weren't good enough, did it at a third of the cost of the traditional fee-for-service. So we took a step further as a legislature a couple years ago, and we created a grant program so that we could replicate the success of the San Francisco Trauma Recovery Center, did it in a bipartisan fashion, and we now have $2 million in grants provided annually, and we have now replicated this successful program in San Francisco 5 times around the state. There are 2 in Los Angeles, 1 in Long Beach, 1 in Solano, and 1 in Stockton counties. Stockton. This is a competitive grant program. The reason we're here today to discuss this is that Prop 47, which, as we know, passed with about 60% of voters in 2014, earmarked 10% of the expected savings for use to benefit the victims of violent crime, and to do it through a Trauma Recovery Center program, grant program. So the funds for this successful program are about to grow exponentially, and what this bill specifically will do is establish statutory guidance on what truly constitutes a Trauma Recovery Center and what basic programmatic parameters must be met in order for a TRC to receive this new state funding. And as we are just about to see the benefits of the savings of Prop 47 in the coming year, this budget before us for 16-17 has monies appropriated for the first time, and they are expected to grow. In fact, the estimates are once Prop 47 is fully implemented, there could be $200 million annually in savings, meaning $20 million for victimized crime, victims of violent and traumatic crime. So the bill also establishes the San Francisco TRC as a model TRC of excellence designated to provide technical assistance so we don't have to reinvent the wheel. San Francisco can help and train new TRCs so that the critically proven cost-saving model of care they have championed is followed as the larger grant program expands. So again, this is all about better outcomes at lower costs for victims of violent and traumatic crime. We're very fortunate today to have Dr. Alicia Bassarelli from San Francisco's Trauma Recovery Center, who has really built this program. And if anyone is ever in the San Francisco area and you want a tour of it, it's an astounding program, and you'll see and be able to talk to folks who have had their lives saved by this program. You can imagine what it's like to be traumatized on the street, drive-by shootings in your home, wherever it might happen. This program works. Dr. Bassarelli, thank you for all you've done for victims of crime, and if you'd like to add a few words about this bill.
Thank you. Good afternoon. I'm Dr. Alicia Bassarelli, and I'm the director of the UCSF Trauma Recovery Center. The Trauma Recovery Center is an award-winning, nationally recognized program. It was developed in 2001 in partnership with the State of California Victim Compensation Program. It was initially established as a 4-year demonstration project as an alternative to the traditional model of care as reimbursed by the Victim Restitution Fund. This model provides comprehensive services for victims of crime that includes assertive outreach, case management, and trauma-focused psychotherapy. It is designed to remove barriers to care and to increase access to victim services and to mental health care. If this model proved to be successful, the intent of the legislature was to implement this model on a statewide basis. As Senator Leno has mentioned, this demonstration project has been established, and we've proven that it has been clinically and cost-effective. For example, 77% of victims receiving TRC services engaged in mental health treatment when compared to just 34% that received customary care. We were also able to demonstrate that we increased the rate by which sexual assault victims receive mental health services. That increased from 6% to 71%. In keeping with the original intent of the demonstration project, this bill would authorize the board to use an evidence-based model when selecting and implementing additional trauma recovery centers. Why should we use an evidence-based practice? Evidence-based practices are developed through research, and they are interventions that have been shown to work and have been shown to improve client outcomes. This model has certain core elements that can be implemented across diverse communities and geographic regions, and yet these elements are flexible and adaptable and can be modified to fit local needs of local communities. Let me give you an example. In San Francisco, in addition to treating victims of violent crime, we also treat victims of political torture from around the world. Over the last few years, we've treated more than 200 patients from 45 different countries, 21 different ethnicities, and 7 different religions using this model. Again, this model is flexible and adaptable. Victims of violent crime often experience the devastating psychological impact of violence. They represent some of California's most vulnerable citizens. Providing services to them according to best practices will be money well spent. Why not use a model that the state of California has already developed and has spent considerable time and energy and money in creating? If passed, this bill would make it available to additional victims of violent crime throughout California. Thank you.
John Lovell on behalf of the Association for Los Angeles Deputy Sheriffs, the Los Angeles County Professional Peace Officers Association, California College and University Police Chiefs, Los Angeles Police Protective League, and another half-dozen law enforcement organizations. We're all in support support of this legislation, and if I can be permitted one personal comment, when Senator Leno was first working in this subject matter area, I took his bill home to my wife to look at. Some of you know that when my wife was 9 years old, 2 members of her family were murdered in what is still today the worst mass murder in Los Angeles history. She read through the bill and read through the program, and she said, honey, God, if this had existed when I was growing up, my life and the life of our family would have been different. This is an excellent bill. We strongly support it.
Mr. Chair, John Bowders, on behalf of Californians for Safety and Justice, the sponsors of this bill, great appreciation to Senator Leno for his leadership over the years on this issue for victims of violent crime, and in full support of the evidence-based model the TRCs provide, asking you to vote aye today.
Thank you. Anyone else in support? Opposition? We have support or opposition coming up?
Linda Warner with the California Catholic Conference in strong support.
Thank you. Anyone else in support? Seeing no opposition, questions, comments? Seeing no questions or comments, would you like to close?
I love this committee. I ask for your aye vote.
Thank you. Does that mean because you love us, we're going to vote for you?
Thank you for your attention. I hope we can have your support.
Thank you. Move the bill. Motion by Senator Wolk. Item number 13, SB 1404, Leno, do pass to public safety. Call the members, please.
Hernandez.
Aye, because I love you.
Hernandez, aye. Nguyen. Aye. Nguyen, aye. Hall. Mitchell. Aye. Mitchell, aye. Monning. Aye. Monning, aye. Nielsen. Aye. Nielsen, aye. Pan. Aye. Pan, aye. Roth. Aye. Roth, aye. Wolk. Aye. Wolk, aye.
Thank you.
I'll take it. Thank you very much.
8-0, enough to get out. We're going to place that bill on call. Folks, Galgiani here?
I don't know. Is she here? She's not here.
Is she ready? You ready? Okay. All right, Senator Nguyen is still not yet. Looks like we're going down the list. Senator Pan, would you like to do your bill next? Item number 7, SB 1238. That is inmates' biomedical data. And we have support on both sides, just for your information. Please proceed.
Okay, well, thank you. Thank you, Chair, Senators. I would like to start by thanking the Chair and the committee staff for working with me and my staff on the bill. We acknowledge the privacy concerns and have agreed to work through those concerns in the Public Safety Committee. I'm pleased to present to you SB 1238, a bill that will allow healthcare providers to publish and learn from non-experimental medical data in order to provide higher quality healthcare while still protecting inmates' privacy. Prisons face unique and sometimes deadly healthcare crises, and however, the inability to publish data-backed best practices can contribute to the challenge of providing quality healthcare to California's more than 127,000 inmates who are disproportionately Black and Latino. Non-experimental medical data can save lives, and in fact, last summer at San Quentin proved that. In August 2015, a microscopic bacteria contaminated the water supply in San Quentin State Prison. A physician working in the prison noticed an unusual number of inmate patients with pneumonia, and 2 hours into a collaborative email chain, the healthcare providers at San Quentin identified Legionnaire's disease as the cause of the pneumonia increase. This quick identification, effective treatment, prevented a crisis from becoming fatal. This medical data saved lives. But current law makes it impossible to publish this information, prevents others from learning how to best handle similar healthcare crisis. This bill would permit records-based biomedical data published involving inmates that uses existing information but does not allow prospective interaction with human subjects. It would not allow experimental biomedical research in prisons. I want to emphasize that, not allow experimental biomedical research in prisons, and no individually identifiable records will be used or disclosed without approval of a research advisory committee and written authorization of the prisoner or permission granted by specified provisions of the HIPAA regulations. SB 1238 enables healthcare providers in prisons and jails to learn from best practices used at state correctional facilities. I'm grateful to have with me here today as witnesses Joyce Hayhoe, the Director of Legislation Communications for the California Correctional Healthcare Services, and Roscoe Barrow, the Chief Counsel for the California Correctional Healthcare Services, to answer any technical questions. Thank you so very much.
Thank you. Joyce Hayhoe from the Receiver's Office, here in strong support along with our Chief Counsel. I think the committee analysis and Dr. Pan has said it all. So if there are any questions, we're here.
Thank you. Anyone else in support? Opposition? Comments? Questions? Move the bill. We have a motion to move the bill by Senator Monning. Would you like to close?
Respectfully ask for an aye vote. Thank you.
Thank you. We're at item number 7, SB 1238, PAN, and that is due pass to public safety. Call the members.
Hernandez.
Aye.
Hernandez, aye. Wen. Wen, aye. Hall. Mitchell. Mitchell, aye. Monning. Monning, aye. Nielsen. Nielsen, aye. Pan.
Aye.
Pan, aye. Roth. Roth, aye. Wolk. Wolk, aye.
Thank you.
That currently has 8, enough to get out, but we're going to put that bill on call.
Thank you.
Looks like we'll move to item number 11, SB 1316, Woke, Tissue Banks, Human Milk. Good afternoon. Good afternoon, Senator. Welcome.
Thank you, Mr. Chair. All medical communities are in agreement that mother's milk is the best food for infants. As evidence continues to mount for the health benefits of mother's milk, particularly for babies born prematurely, there's been an increased demand in human breast milk and a subsequent commercialization, a fairly recent commercialization of breast milk. This widespread practice of incentivizing a mother financially for her breast milk is a relatively new phenomenon. My bill, 1316, does not prevent a woman from being compensated for her breast milk. However, it does provide protections in the law that would ensure the safety of the mother and baby during the critical first few months. SB 1316, first of all, requires the Department of Public Health to establish regulations of human milk tissue banks uniformly based on the scientific evidence-based standards that are followed by a national group of milk tissue banks, the Human Milk Tissue Bank Association of North America, HUMBANA, this is the acronym. This bill also says that if a human milk tissue bank is providing financial compensation to mothers, they cannot offer this as an incentive in the initial critical months of birth. 1316 provides transparency to the mothers as they engage in a business transaction with a milk tissue bank. In addition, it requires human milk tissue banks to work with local, community-based, or hospital-based education and lactation support groups to ensure the health of the baby. 1316 is an important first step to establish clear and ethical standards for this emerging human milk banking industry and ensures that all babies in California will have a chance to a good start. With me today is Pauline Sakamoto, who's the Executive Director of the Mother's Milk Bank of San Jose and President of the Board of Directors of the Human Milk Banking Association of North America. Dr. Susan Crow, physician and professor of obstetrics and gynecology at Stanford Medicine, and Brandy Gates, a breastfeeding specialist and lactation consultant, to testify in support of the bill.
Thank you.
Thank you. I respectfully ask for your aye vote.
Thank you.
Senator, well, thank you for the opportunity to speak to this committee today in support of SB 1316. On behalf of the Board of Directors of the San Jose Mother's Milk Bank, we would like to thank you for your passion and dedication to health of all babies and mothers in California. My name is Pauline Sakamoto. I am the director of the San Jose Mother's Milk Bank, your only nonprofit milk bank in California, and I'm also currently the president of the Human Milk Banking Association of North America. San Jose Mother's Milk Bank began in 1974 It is the oldest continuously operating milk bank in North America and was founded on the principle that the community holds the power to solve the problems that it faces. Recent studies on human milk availability from our milk bank for 2007 to 2013 shows the increase in California that we served from 27 hospitals to 55. So there is an increased interest in using donor human milk in the NICUs. This equates to 81.3% of the NICU babies in your counties and in this state that have accessibility to human milk. The impact of this study and what we're doing in the state of California is when the families do have the opportunity to get donated human milk from these mothers, that the breastfeeding rate in the NICUs in this state go up by 10%, and the percentages of necrotizing enterocolitis, which is a horrific condition for preterm infants, decreases by 2.6%. A condition of membership for Humbana is that the nonprofit milk bank will not provide financial incentives to the donors. Research supports Humbana's policy for not compensating donors for human milk. As scientific evidence has mounted to support the use of pasteurized donor human milk, the demand has increased. Community-based, nonprofit milk banks have a mission to ensure that it isn't who you know, your access to information, or how much money you have to pay for the milk that determines your ability to provide human milk for your child. We need this legislation to make sure our babies in California do not get caught up in the competition or the crossfire with companies seeking to drive supply of human milk in California to support products. We urge you to support this bill. Thank you.
Good afternoon. I'm Dr. Susan Crow, and I'm an obstetrician and gynecologist. I'm here on behalf of the American Congress of Obstetricians and Gynecologists to strongly support SB 13. My colleagues in the American Academy of Pediatrics in California also strongly support this bill. The legislation will improve infant health outcomes, save taxpayer funds, and reduce the costs for California's neonatal intensive care units, NICUs. Every 6 minutes, a preterm infant is born in California. Every day, California infants weighing less than 2,500 grams, 5.5 pounds, may require care in the NICU setting, which may cost $40,000 to $80,000 per infant. One of the complications that can occur during their care is necrotizing enterocolitis, NEC. American taxpayers pay more for NEC than any other complication of prematurity, with severe cases averaging 62 days of hospitalization and $300,000 per patient. Infants' risk of NEC is more than doubled if they don't have access to human milk for feedings. I, as an obstetrician, counsel my patients who are going to be delivering preterm infants of the importance and really the medicinal use of breast milk for their infants. They cannot always provide this milk immediately at delivery. And this human donor milk through the Mother's Milk Bank is what they are fed. The lack of regulation in this industry has created an opening for experimentation potentially at the expense of this vulnerable group who cannot advocate for themselves. Non-evidence-based therapies are flooding into hospitals under the guise of donor human milk, when in many cases this milk is not donated. It is from a paid provider. This legislation will not curtail innovation, but will level the playing field for babies who are depending on you to protect an equitable supply of donor human milk in California. The rush to commoditize human milk from from mothers under the guise of economic opportunity and/or to advance expensive synthesized human milk products for use largely outside of our state must not happen at the expense of California's most vulnerable residents. Thank you.
Thank you.
Hi, my name is Brandy Gates. I am a lactation consultant in the Oakland, Alameda County area. I'm also the co-founder of the Breastfeeding Mafia, Mothers Against Feeding Infants Artificially. I just want to thank you for allowing me to speak in support on this bill. In California, there is a significant health disparity in preterm and low-term birth weight babies. While the overall preterm rate in California is 8.3%, African American families have a preterm rate of 11.8%. And given this rate, about 93% of our moms in California initiate breastfeeding, but only 60% do so after the first month. About half of our California infants are involved in the WIC program, which is a supplemental nutrition program, and we offer free supplemental formula to our participants after 1 month postpartum. I believe it's not coincidental that we are seeing companies come into our state and start to incentivize on these women and want them to sell their milk at their baby's expense. There is a high possibility that the motivation of the mom is that she will choose to sell her milk instead of provide it to her baby. And we see that we have the most compromised infants in California in the Black community. It is, if we have market forces to determine the distribution of human milk is at the disadvantage of lower income families. The corporate milk banks don't necessarily increase the supply for human milk for babies by my cultural group who are in need of it most. The resale for research of our I'm sorry, I'm so nervous. This is not what I do, but at the higher price of the human milk distribution, we need to distribute it equitably amongst everyone, not just at a certain population. I've heard some of the milk banks for profit, milk corporations saying that this is an anti-choice bill and that it's an argument that we pay women for our profit and they mark up the milk. But I've also read that they say that it's notable and honorable for women like myself, breastfeeding mothers, to sell our milk. I feel like that is a straight disrespectful comment to the African American community based on our history here in this country, that we should not be able to just sell our milk to whoever may have the money to pay for it. In closing, when women are in poverty, they experience wage inequality and possibly lack paid family leave, and there is no level playing field around those who can afford to donate their milk and those who may be attracted to selling their milk at their baby's expense. I urge you, this legislation, to support this bill.
Thank you. Anyone else in support? Name and position.
Marian Rice with the Human Milk Banking Association of North America. We strongly support this bill.
Thank you.
Sarah Diaz from the California WIC Association, and we support this bill.
Thank you. Anyone else? Support?